Hi, everyone. This is Lisa Majeski West coming to you again with some more steps to implementing telemedicine in your practice. Wow, we have had such a wonderful week this past week doing some telemedicine webinars for you. And, I think I've presented about 2 hours of instruction on how to get how to get telemedicine going in your practices. And so I've gotten some tremendous feedback from everybody about this, but one of the things that I wanted to go over with you again and really just spend a few minutes talking to you today is the actual, like, what do we do first? What do we do second? What do we do third to actually get telemedicine implemented in our office? And so I thought it would be a good idea for us to just do a recap of how we need to implement telemedicine. And so let's go ahead and get started. So the first thing that you would want to do is, if you're asking yourself this question, how do I implement telemedicine in the quickest and most efficient way possible? All right, so the first thing you're going to want to do, and I hate to say it, is watch the webinars. So the first thing I would ask you all to do is, if you haven't watched the previous webinars on telemedicine, I would strongly encourage you to do that. And to do this, you would simply go to daily.amidoctors.com, click on at the top of the screen, click on replays, and the 3 webinars that I taught in this order are adding telemedicine, doing it right with compliant billing and documentation requirements. That was the one that I presented on March 20th. Webinar 2 is nuts and bolts, A to Z, how to utilize telemedicine in a physical medicine practice. Did that one on March 24th. And then the last webinar was on telemedicine and bracing and how you can deliver bracing via telemedicine. So, guys, I know that everybody is kind of webinared out right now, and you're because we're doing everything virtually, you may be a little bit overloaded with the webinars, but it is really important for you to listen to these 3 webinars to get the good overall picture of telemedicine and how it works. And it really will answer the majority of the questions that are being emailed to me or people calling in with questions about telemedicine. Usually, I can tell if you watched the webinars and if you haven't, depending on the questions that you're asking. And so I would strongly encourage you to review the 3 webinars at the daily.amidoctors.com website to really get a good overall picture of what telemedicine is and what it's about, and how it can really positively affect your practice and your patients during this COVID crisis. So after you've watched the telemedicine webinars, then the next thing you're going to do, or really the first thing you're going to do, really to go from theory to implementation, is figure out your platforms for telemedicine. Now, one of the things I want to stress, and I need to stress this very strongly, is that you do not need to buy a webinar platform or a telemedicine platform. You're going to get a lot of solicitations right now from companies that are selling HIPAA compliant telemedicine platforms, and some of them are very expensive. Some of these companies, you go and look to purchase the platforms, and they're telling you that it's because of the volume of people that are buying these platforms, it's taking several weeks to get them set up. It is not that complicated, okay? The Department of Health and Human Services at this point, because of the lifting of the HIPAA enforcement actions, has stated that Skype and FaceTime can be used for your telemedicine platform. So all you need are smartphones. You really do not need to look to purchasing any expensive telemedicine platforms at this point. Now, once the whole COVID crisis is over and things begin to normalize again, you may very well, if you're wanting to continue telemedicine at that point, you may very well need to get some type of a more HIPAA compliant platform. but we don't even know what the rules are going to be for telemedicine after the COVID crisis is the national emergency designation is lifted, because prior to this designation of national emergency, telemedicine was extremely restricted to rural health clinics. Patients had to go to a rural clinic to initiate a telemedicine visit. I don't believe that it's ever going to go back to that level of restrictiveness for telemedicine, but we really don't know where it's going to land. So for right now, if all you need to worry about is making sure that you have a platform available for patients who have a smartphone as an iPhone or an Android type of phone. So if their phone, the patient's phone, is an iPhone, for example, then you're going to want to be able to FaceTime with that patient to do your telemedicine visits. If their smartphone is an Android, or if they're using their computer, then you're going to want to use something like Skype or Zoom. And all of these platforms are free. The Zoom platform, there is a paid subscription, but there's also a free platform that you can use for, up to 3 people on the call. And I mean, it's free. So you don't have to spend any money to get your telemedicine platform. So that's the first thing that you're going to do after you have watched the 3 prior webinars that I taught. The next thing you're going to want to do is identify your patients. Who are you going to target for telemedicine visits? First of all, new patients. You can do telemedicine with new patients. So if a new patient does happen to call in and they need assistance and they need care, you can schedule them for a new patient exam through telemedicine. Also, you're going to want to target those patients that you already have that are under active care, or who have recently been under active care, who need to have their treatment continued. The other target are going to be patients who have chronic health problems, your patients who have chronic back problems, chronic neck problems, whatever the case might be. So this is a conversation that you as a provider need to have with your staff and start coming up with a short list of patients, maybe about 100 patients or so that fall in this criteria. The next target of patients would be patients of yours who need to be reactivated. This is a marvelous reactivation tool to get your patients back under care and get them engaged. And then you can start looking further out from your patient base to possibly your community and maybe even your state. I've even had a few of you who have contacted me and said that you're wanting to make this a national program. You'd like to offer telemedicine nationally. And of course, that's a great goal. However, I really believe that we need to start at home with our own patients, because let's face it, at the end of this crisis, what we want is a practice to come back to. And those are going to be your established, loyal patients who you need to continue to engage with, even in spite of the fact that your office may be closed, or you may be under a shutter in place, or a voluntary quarantine or something like that. So identify who you are going to want to deliver this telemedicine service to. Get the platforms established, Skype, FaceTime, very, very simple. Then identify your patients. The next thing you're going to want to do is start calling them. And this would be a preliminary phone call to let them know what options they have. Ask them how they're doing. First thing you want to do is, before you start pitching anything to them, is ask them how they're doing. Are you okay? Is your family okay? Is there anything that we can do for you? All right. Now, if you're still open for business during this call, let the patients know that. Okay. And this is going to be a huge grassroots campaign on your part. But look, you're needing to keep your staff busy. You're wanting to give them something to do. Hopefully, you all are taking advantage of some of the economic stimulus that is allowing you to keep your staff on payroll. Well, if they're on payroll, but you're not really seeing that many patients, then this is a wonderful project for them. Okay. is get them on the phone and start calling your patients, letting them know if you're still open. Let the patients know that you're still open and that you're taking all precautions for patient safety. Let them know what you're doing. So maybe they will even consider coming in for a visit, because ultimately that's going to be the best option for them, is if you can get your hands on them and adjust them and work with them physically. But if you can't, and if the patient doesn't feel comfortable coming to your office, then you let the patient know that you could provide them some treatment via telemedicine. And what you need to do is you need to think about this before you talk to the patient, because you want to give the patient examples of what you could offer them via telemedicine. It could include some physical therapy, virtual therapy, durable medical equipment or bracing, nutritional counseling, TENS units, bracing, etc. And this is based on services that you offer in your office that could be delivered via telemedicine. If the patient is interested, then schedule them for a 15-minute telemedicine consult. This is going to be the very first formal call you make with them. Now, these preliminary phone calls are not billable to insurance. This is your campaign to engage your patients and get them involved in telemedicine visits. If once you've scheduled them, then email or fax them the telemedicine consult form and the informed consent form to them. And again, I have these forms available. I've also sent these forms over to AMI, so they have the forms available to you if you need copies of them. So just contact me or contact AMI, and we can get those forms over to you. You can customize them for your practice, but you need to get those forms over to the patient so they have them in front of them for that first consult. Okay. The next step, number 5, is your actual telemedicine consult. So this is where the ancillary staff, your med tech, a CA, or a chiropractic technician would start the call. They would contact the patient. They would go over you should have the patient history, their chart available. So the staff would go over the patient history. If it appears that the patient history is out of date, like it's over a year old, then update the patient history as needed and document that, update the documentation. Make sure at that time that the ancillary staff will go over and fill out the telemedicine consult form with the patient, go over the informed consent, and then the provider would come in and then conclude the call. At that time, they would review the history that's recorded by the ancillary staff, recommend treatment, and schedule the patient for the first telemedicine visit with the provider, and instruct the patient on how and when to call in for their visit. Now, this first telemedicine consult is called a virtual check-in, and this is a billable code to the payer. You would bill out code G2012 or virtual check-in. Now, what we are finding is that most payers are covering this. And I mean, it's not going to be a lot, probably $10, $15, $20 that will be covered by the payer, but they will generally cover this virtual check-in call. Okay, so this is actually a sample telemedicine consult form. So when your ancillary staff is calling the patient for that first visit, they're going to basically ask these questions of the patient. So you're going to review the history, as I said, and then the next thing, and the telemedicine consult really deals with the nuts and bolts of the actual telemedicine visit. So where is this telemedicine visit going to take place? At the patient's home? Does their home or apartment have a private room? That if they do have a private room, then of course you would want to notify that, because what you're trying to do is you're trying to make a good faith effort to ensure patient privacy. So this is why you're asking these questions. Is there a free wall for the patient to support themselves? So if you are doing exercise instruction, you know that the patient can do this in a safe manner, and to where possibly they're not going to be at risk of falling or injuring themselves. If they're an older patient, or if they are not very mobile, is there a rigid or a folding chair available to where they can be seated while they're doing some of these exercises? And are there stairs in the home so that possibly you could do some gait training with that patient? Does the patient have a computer? Do they have a webcam? This is where we're going to talk about the technology of the actual telemedicine visit. How are we going to do this? Is it going to be FaceTime? Is it going to be Skype? Do we do this on a computer with a webcam? And what is the preferred method of video communication for those telemedicine calls? Also, you would want to find out if the patient has any exercise equipment at home that they can use to assist with the exercises. If not, you might want to suggest having some exercise equipment shipped to the patient. And in some of my previous webinars, there's some information on how to get exercise equipment shipped over to the patient. Also, you're going to want to do a bit of a risk assessment and ask a question about whether the patient is a fall risk or not. If they have a history of falls, then and they say yes, they have had a history of falling in the past, then you would add to your problem list the ICD code Z91.81, and that's not a primary diagnosis. That's listed at the end of the problem list. If the patient has fallen recently or suffers from recurring falls, then R29.6 is used. And so this is what you would want to add to your telemedicine protocol to make sure that you're covering all your bases for that first telemedicine visit that you actually do with the patient. So now, after this call is over and you have gathered up all the information you need about that patient and about the first telemedicine visit, and the provider has given, as you as a provider have given the staff the orders for what you're going to want to do in that telemedicine visit or that treatment plan, then the staff will need to call the insurance company of that patient to verify coverage. And that's going to be based on the provider's recommendation for care. So you do need to check with the payer to see if the codes that you want to bill are covered under telemedicine. And here's what we're finding. Of course, this is also new, but we are finding that some payers have lists of approved codes on their website, so you might not have to call. You might be able to get the list from the payer site. Some payers are wanting you to call. You will want to check with the payer not only for the codes, but for the correct telemedicine billing procedures. So are there special modifiers that we need to use, or place of service codes that you want on the claims? And again, in my prior webinars, I go through this in a fairly detailed manner as to what some of these different telemedicine modifiers and place of service codes are. But suffice to say that for this purpose, you just need to ask. You need to ask the insurance company what are going to be what is going to be the process for correctly billing those telemedicine codes. If certain codes aren't covered by the payer, then you're going to have to go back and let the patient know that unfortunately their insurance company is not covering these telemedicine codes, and arrangements for out-of-pocket payments may need to be made. Remember, for your patients who are going to be paying some cost share on these, that you're going to need to have some type of a platform like Venmo or PayPal to where they can make those payments virtually as well, since they're not going to be in the office to essentially give you a payment. Now, some payers, also some of the things that we're finding out as we're delving more into this, is that some payers are only covering telemedicine as if you're an in-network provider. So if you're an out-of-network provider with that patient's insurance company, make sure you let them know that you're out of network, because we are finding that the payers are definitely favoring in-network providers. Not that they're saying no to out-of-network providers. In some cases they are, but there's definitely going to be higher deductibles and things like that. So just make sure you verify that those telemedicine visits. Now, the next thing you're going to do is after you have scheduled that, you've done that virtual check-in, you're going to do your second call to the patient, or actually the patient is going to call you. They should initiate the telemedicine visit. Okay, this is the typical standard operating procedure for telemedicine, is that it is patient initiated. So what you would instruct the patient to do at the virtual check-in is say, at this time, you need to initiate FaceTime or Skype, and we will be waiting for you. And give the patient about a 5-minute window. If they don't call in, reach out to them. You may need to offer them some additional training on their technology, on getting that call initiated. I would always recommend that for your first patient-initiated telemedicine visit, that you give a little extra time to get through the technology glitches that might be taking place. Once the patient gets on with you, then the provider would come on and conduct that virtual exam. And this is where they would bill, depending on if it's a new patient or an established patient, a 99202 or 203. If they're an established patient, a 99212, 213, 214. And that's, again, that what code to use is going to depend on the type of patient and the levels of history, exam, and medical decision making that are needed to render the service. So it's no different than a regular office visit, a face-to-face office visit in person. You have the same exact documentation requirements that you do, and in order to choose the correct code, you need to make sure that the documentation that you provide supports that code. The provider will then discuss a virtual treatment plan with the patient. How many days a week do they want them to call in, the frequency, what kind of treatment will be done virtually, and so on and so forth. The ancillary staff at the end of that call will come on and then schedule the patient either for their functional exam, if that hasn't already been performed, or for the first therapy session. And then the ancillary staff at that time can do a basic financial consult, discuss virtual billing and payment options, let the patient know this is that you are going to bill their insurance for these telemedicine visits, that there may be cost share involved, and if so, that this would be their payment option, and so on and so forth. And again, the insurance companies, Medicare, are giving very wide latitude for collecting patient cost share. Some payers on the actual telemedicine code visits are for like the virtual check-in or for the online evaluation and management visits. These are going to be, in some cases, payable 100% by the insurance company with no out-of-pocket cost for the patient if the provider is in network. And so this is just going to be, this financial consult is going to be based on what the patient benefits are for that given plan. There's no one size fits all for this, unfortunately. You're going to have to call patient by patient the same way you do if they were coming in for an in-person visit. The next step is going to be the third call all the way to the end of care. So in other words, if you have a patient scheduled for 10 visits, then step number 7 is going to apply for every one of those visits, okay, from call number 3 to the end of care. Now, before you actually get into the actual virtual therapy services that you're going to bill out, you may have a couple of additional appointments. One may be a virtual functional exam, and what we're seeing is that payers are either covering these under 97750, which is a physical performance test code, or 97161, which is a physical therapy evaluation. Again, you'll have to check with your payer to see which of these codes would be covered, if any of them, okay? And if you're prescribing bracing, the telemedicine visit should be scheduled for a fitting or training. You can check with your insurance company on code 97760 if you're fitting a brace or an orthotic, an LSO, or a knee brace or foot orthotics. that would be 97760 if that's covered, or you could use code 99457, which is remote patient monitoring and training. Now that can only be billed one time per month. So if you're going to be prescribing multiple bracing, and the patient gets them at different times, you may want to do the training all at once because you can only bill that particular code out one time. Now, once you have done all of the extra, the functional exam, the bracing training and all of that, then you would bill out for your regular therapy or rehab sessions. And these are billed out with appropriate code, CPT code 97110, 116, just, it depending on the type of therapy that you're doing. So if you're doing physical exercises, it's 97110, gait training 97116, neuromuscular reeducation 97112. And again, it's extremely important for you to check with the payer for the guidelines on the place of service and the modifiers needed to bill those out. But when if you're doing rehab virtually with the patient, you're just going to bill the same rehab codes that you would if you were seeing them in person. You just might need to append it with a different modifier or a different place of service code. So those are your steps for just getting the ball rolling. Now, there are more virtual health opportunities that are an additional way for you to bill out virtual health services or even just engage with your patients. And so I wanted to bring these up to you now. I'm not going to go over them in this particular webinar because, again, I want this webinar to be to get you guys moving and get you guys starting to implement the telemedicine and get cut through all of the red tape, cut through all of the extra stuff, and show you how easy it is to get started with telemedicine. But here are some other opportunities that you could explore. Remote physiologic monitoring. Now, I talked about that in some of the earlier webinars, so you can listen in on, I think my first webinar talked extensively about remote physiologic monitoring, what codes, these are billable to the payers. I am planning on doing a specific webinar on remote physiologic monitoring, so stay tuned for that. Group therapy and exercise classes we are seeing are billable to some payers. So you may want to schedule some of your existing patients with some group therapy classes. And if the patient is qualified and they have established themselves as a patient at your office, you could bill that 97150 group therapy code. Also, think about using your telehealth platforms and your telemedicine platforms for other things like patient engagement activities. This is something I'm really, really burdened about, thinking about what is going to happen to all of our practices after the COVID crisis is over. Because if you close your doors and you do not engage with your patients for 2 or 3 months, I'm going to almost, if I had a crystal ball, if I was a patient and my provider said, well, we're just closing our doors until the quarantine is lifted, and I need something, I need health services, I'm going to start looking elsewhere. And so by the time you open your doors, you might not have a practice to come back to in the same way that you had it when you close the doors. You're not going to be able to open your doors, and it's just going to be business as usual. If you are engaging with your patients on a regular basis, maintaining contact through video chats, through through little visual blogs or little tips, providing valuable tips on maintaining their health through these virtual talks like fireside chats with your patients. These are things, if you do these on a weekly basis or every so many days, every 2-3 days a week, give them a stretch of the day or a recipe of the day or something to keep those patients engaged with you. it's going to make it much, much easier for you to reactivate your practice once this crisis is over. Engage local businesses. This is another way that you can reach out to local businesses and help provide valuable advice and services to your business's employees for free. You know, your businesses in your community are looking for value for their employees. And so you want to find opportunities for you to talk to a local business virtually and have a talk with all of their employees, all right, and let them know without any strings attached what is available for them to help them with their immune system, help them maintain their sanity. It could be a number of different things that you talk to them about. And I guarantee you, those businesses and those employees will be so grateful to you for the additional help that you've given them for nothing. And it is just going to create those warm fuzzies that will elevate your practice to a whole new level within your community. Another thing that you might want to explore is contacting your public access cable TV station. And they're always looking for content. As long as you're not selling anything, you can do a daily health talk and schedule, see about scheduling a daily health talk on public access. And I have always been extraordinarily surprised at how many people watch public access, especially now because this is where they're going to get their local COVID updates. And so public access cable is a wonderful way for you to engage with your community. And remember that the AMI coaches and your vendors are here to help you. That we've got vendors that can help you with texting applications, mass texts, mass media. I'm here to help you with billing and coding for these virtual health services. We've got Azon Medical, who is helping you all out with your bracing and the training on bracing. And so you have a village, a community of professionals who are here to lift you up and help you be successful during this crisis and maintain your level of growth and even help you grow more in spite of this crisis. Okay. And it really all boils down to your state of mind and your attitude. Are you going to let this crisis overcome you and your practice, or are you going to push through in spite of it and make the best of it? And not only make the best of it, but look for new ways to grow and to thrive in this new healthcare environment. All right, well, we're here to help you. I want to thank you for listening in today. Again, this isn't quite as long as some of the others, but I just wanted to really push you all along and get you started with your telehealth services. If you need me to do a consultation with you about your own particular practice, feel free to call me. My number is here on the screen, 866-942-5655, and I will be happy to provide you with a complimentary consultation to discuss which programs or options are best for your practice. You can email me, lmajeski@goldstarmedical.net. You can visit our website. All of these telehealth webinars that are on the daily.amidoctors.com website are also available on my website in the webinar archive. So you can go either place and listen to those other preliminary telehealth webinars for your education and your additional knowledge. And I just want to thank you all for attending again today and listening to me. I hope this helped put everything in perspective for you and give you the tools you need to implement telemedicine quickly and effectively in your practice. Thanks, everybody. Good night and God bless.